Hi, I'm Ron Dykes, president of OrthoMed, and I have Dr. Michelle Carlson with me today to discuss the development of her unique pronator retractor for distal radius fracture repair. Dr. Carlson's team reached out to me in 2015 when they were searching for a company that could manufacture it for her. OrthoMed has been in business for over 50 years, and we have built our reputation as not only a great source for quality surgical instruments for hospitals and surgery centers, but also for our ability to develop unique, specialized instrumentation for original equipment manufacturers. Dr. Carlson sent us a prototype she had made at a local machine shop, and from the prototype, we created the prints to send it to our factory in Germany for production. Hi, Dr. Carlson. Thanks for joining us today to discuss the Carlson retractor. To get started, can you share a little of your background with us and then tell our audience what prompted you to develop this unique retractor?
Hi, Ron. I'm a hand surgeon at the Hospital for Special Surgery in New York. I've been in practice for 30 years and I've been doing hand surgery for 30 years. Over the past 10 years, treatment of wrist fractures has really substantially changed. We used to put fixators on the outside of wrists. So over the past 10 years with new plating techniques, we've started doing open reduction, internal fixation of distal radius fractures, much more than we ever did before, to the point that now we often do several of these a week. And I noticed that when I was trying to do open reduction, internal fixation of the distal radius, the pronator muscle kept getting in my way, and there was no good retractor to get that pronator muscle out of the way. And that's when I developed this pronator retractor to assist in doing these distal radius fractures.
Great, thank you. Can you elaborate a little more on the rationale behind the design features of the retractor?
Sure. So when you're doing a distal, I have a model here I can show you. So when you're putting a plate, this is on the palm side or volar side of the distal radius. You're putting a plate on the radius here. This bone, when you first come down to it surgically, is covered by a muscle, the pronator muscle. And you cut the pronator muscle on its edges and fold it back so that you can put the plate on. And the problem is there's just not a good retractor to hold that muscle back, because really what you want is something that's going to hook around the bone here. And so this retractor, which is what I developed, hooks around the bone and allows you to hold that muscle out of the way. Retractors that were available before didn't have these wings on it, and so they could hook around the bone, but the muscle would just fold over the side and get in your way as you're trying to expose the radius to put your plate on. So with this adaptation of a retractor, it nicely sits around the bone. It holds this muscle, which then sits behind the wings here out of the way. So it's very easy to even just put one finger on it, and easier in a person than it is right here, but to put one finger on it and hold everything out of the way so you can then put your plate on the radius. So I said, gee, I'd love to have a retractor like that. I had a machine shop fashion it for me, but of course then it's not surgical grade and not acceptable to be used in the operating room. So that's when I decided to come to you to have you make something that would work.
Okay, great, thank you. I know you also, the tip is a special design that helps avoid median nerve damage. Maybe that a little bit.
Sure. So one of the other problems is if you just use, so the median nerve sits right above, superficial to this muscle. And if you just used a regular wide retractor where you pull the muscle back, you'd also put a lot of tension on the nerve. So in this way, because the flange isn't very deep, it only pulls the muscle out of the way. But up here where the nerve is, it's much narrower, so there's much less tension on the nerve. So that's another significant benefit of this flange being just this depth.
What are some of the specific distal radius fracture patterns you see where this retractor is advantageous? And what specific advantages does it offer over what you've used as a pronator retractor in the past?
Yeah. So again, when you need to get to this ulnar corner of the distal radius where there's often a fracture fragment, it can be very hard to get a retractor in there to show that corner. And by using this retractor, it just so nicely gets that corner out of the way without pulling on the superficial soft tissues. So especially fractures that have articular fractures of that ulnar corner, this can be very helpful. But I use it with every distal radius fracture because it just makes it so much easier.
Are there some other fractures that you also use it with where it's helpful?
Yeah, so I've found since developing this retractor, for instance, if I do an ulnar shortening osteotomy, there's muscle around the ulna, and that's another surgery that I frequently perform. And using this retractor allows me to protect that muscle when I'm doing the osteotomy. So you're cutting with a saw, there's muscle on both sides, and I can easily put one of these on either side and protect the flexor carpi ulnaris or the extensor carpi ulnaris muscle as I do make the cuts so that they don't get injured with the saw blade. So anytime you're working around a small bone and there's muscle there that you want to protect, it can be very helpful. I've heard people who use it in foot and ankle have found it helpful. Up in clavicles, people have told me they've used it and found it helpful. So lots of places where you have a small bone you need to be around and want some soft tissue protection.
So, Dr. Carlson, my last question, is there anything else, Dr. Carlson, that you'd like to share about the Carlson retractor?
I have to tell you that when my fellows see me use it for distal radius fractures, they always say like, that's so cool. That's perfect. How'd you get that made? Because they haven't seen it before. And so I tell them how, awesome it was going from design to, production of this retractor. And, they always want to know how they get one, because when they go out and practice, they want to be able to have one also. So it's really been a very special experience. And having this retractor, the OR always knows I want my retractors whenever I have a distal radius fracture, because it's just so nice to be able to slip them right into the exact right spot.
Great. Thank you, Dr. Carlson, for your overview today of your unique retractor. It's been very informative. Dr. Carlson, thank you so much for your time today. We really appreciate it.
Pleasure. Thank you, Ron.